Alright, so we're looking at another type of surgery which could be done on the cervix. So this one, just like the name implies, a cone is a cone. Alright, biopsy is more of like I'm taking some set of tissues to go and do a test. Do you understand? So cone biopsy just simply means I'm taking some tissues from the cervix, but the shape is like a cone. As simple as that. So it's also known as what? Conization. Process of making a cone out of the cervix. It's a surgical procedure which is used to remove a cone-shaped piece of tissues from the cervix. It's typically performed to diagnose or treat precancerous changes that are before cancer. Do you understand? Or you want to diagnose cervix cancer, you know. So why is it done? Maybe to there was pap smear tests that were abnormal, so you want to follow up, you know, treat cervical dysplasia, remove early stage cervical cancer, you know, that is just localized. You just remove the tissues and the whole issue, the whole thing will not spread again. When other tests like colposcopy or punch biopsies are inconclusive. Alright, so how is it performed? You can use a cold knife. Alright, it is a cold knife. Yeah, cold knife. It can be laser, it can be loop. The loop one we have looked at it is something like a shaving stick, so it has a wire on top, so they burn it, then they fetch tissues with it. Alright, so recovery and aftercare, just mild cramping and bleeding for up to 2 weeks at least, at most. Alright, vaginal discharge, avoid tampons, avoid sex, avoid swimming, you know, avoid heavy weight lifting for about 4 to 6 weeks. Okay, so risks and complications, just like with every procedure, bleeding and infection is there. Cervical stenosis, increased risk of preterm birth, alright, because the cervix is no longer that thick again. Alright, then scarring too.